time now is 9:41. Time for our Plastic Surgery Today segment with our sponsor, Bay Area plastic surgeon, Dr. Stanley Jacobs. Today, playing the part of Oprah Winfrey, and you've got your own book club. You love this book.
I love this book,
All right.
and I actually read it.
Good.
And it's called Better by Atul Gawande. And Atul Gawande, if I'm pronouncing his name correctly, because I have not talked to him about this,
Yes.
is that he's a general surgeon, and his father is a urologist, mother pediatrician. So anyway, it's a book about how to be better as a doctor.
But that's the thing is I see this book and I say, okay, I'm not a doctor, and when I see a doctor on the cover like that, I'm going, well, I don't need to read this.
I know, I agree, and it could be more user-friendly kind of that way, and I think that's why you use the word better. It's not like something scary, because his first book was called Complications, which I didn't want to, I didn't want to get it. But, you know, he's got these three things he talks about: diligence, about hand washing, the Iraqi war surgeons. There's some interesting things I'll talk about. To do,
for doctors to do, though. Is that what you're saying?
For doctors. This is for doctors to do.
Yeah.
It's for how can we be better. It's a surgeon's notes on performance for us.
Yeah. Okay.
Okay?
All right.
And then it talks about ethical things that we should do right.
Okay.
For instance, he talks about, you know, executions with lethal injection. Is that the right thing? Should we not be doing that? The American Medical Association has a stance that we shouldn't do that.
Okay.
Ingenuity about cystic fibrosis. For instance, the hand washing thing's interesting. There was a guy, you wash your hands all the time.
Of course.
We know it's a good thing.
No, we just did a study last week in the news. You heard about this. Nobody washes their hands, especially men. That's what they said. And men in Colorado. No,
because they don't touch.
So but what?
No, well, for instance, there's an interesting guy, Semmelweis, in Austria in 1850, found that women were dying 20% of the time with childbirth.
Yeah.
Because of bacteria somehow getting up the birth canal. He said every doctor should wash their hands. It went to 1%. But he was kind of crazy. They threw him out of the hospital because he said he was nuts.
Right.
So, you know, that shows you sort of how medicine is traditional, and sometimes we don't really do what we should be doing.
Like,
we do.
back up, wash your hands. Here's something I got an idea.
Sense.
Yeah.
You know,
yeah.
in Iraq, they have these forward surgical teams he talks about. These guys are surgeons and nurses that are in like a mini OR that follow in Humvees right behind the front lines.
Yeah.
These guys are now treating people right there on the spot.
Yeah.
It's unbelievable.
Yeah.
The incidence of death used to be 25% in the first Gulf War. It's now less than 10%.
Okay, so
it's
why, well, I guess two quick things. Why do you like this so much? Why are you crazy about this book? And why should I read it as not a doctor?
Because it tells you what doctors really should be doing, so you can talk to your doctor about
these ideas. It's kind of like the inside scoop.
It's the inside scoop. Like here, I got to read this.
Okay.
Betterment is a perpetual labor. The world is chaotic, disorganized, and vexing, and medicine is nowhere spared than that reality. To complicate matters, we in medicine are only humans ourselves. We are distractible, weak, and given to our own concerns. Yet still, to live as a doctor is to live so that one's life is bound up in others, and in science and in the messy, complicated connection between the two. It is to live a life of responsibility. The question then is not whether one accepts the responsibility. Just by doing this work one has. The question is, having accepted the responsibility, how does one such work well?
You know what it sounds? It sounds like church for doctors. No, you know what I'm saying? It's like the whole kind of step back and think about who you are and what you're doing.
That's exactly what we need to do.
Yeah. Okay. Thank you, Dr. Jacobs.
You're welcome.
And if you have any questions, you want to learn a little bit more, talk to Dr. Jacobs. You can go to his website. You can also call the phone number, which we usually have on the screen. If we don't, go to crownford.com because we have everything there. We'll be right back.